Hello. My name is Sarah and I will be your nurse today. Can you tell me your name and date of birth? All right, thank you, Mrs. Smith. Let me just check your doctor's orders. So it looks like today we will be doing a urinary catheter insertion. And what that means is we're going to take a tube and insert it through your urethra into your bladder. And that's going to help with any distension and discomfort you've been having. And also it's going to allow us to collect a specimen. So I'm going to raise your bed up. Do you have any allergies that we should be aware of? Latex, betadine, iodine, anything like that? No? Okie dokie. Well, I'm going to put on my gloves. I'm going to pull back the covers so I can begin the procedure. Now, for a male for this procedure, they would be in the supine position with thighs slightly apart. And for a female, they would be in the dorsal recumbent position. But for the sake of this video, the female is going to be done in the supine position with thighs slightly apart. So I'm going to lift up the gown. And I'm going to start by performing perineal care. So I'm going to clean the perineal area, going one side down, then the other, making sure to use a different corner each time. I'm going down the center. And I'll make sure to dispose of the linens in the proper linen basket. And now I will begin my procedure. I'm going to use the bag that all of my supplies came in as my trash bag for this procedure. So I will start by opening the package and putting on my sterile gloves. Alright, and Dr. Andrews, you said that we didn't need to use this sheet, so I'm going to go ahead and discard of it. I'm going to go ahead and open the other sheet with the water resistant side down to extend my sterile field. The first thing I will do is I will take my syringe with 10 cc's of sterile water, and I will test to make sure that my balloon is working properly. I will insert and slowly inflate the balloon. And it appears to be working correctly, so I will uninflate the balloon. And leave the syringe there. I will remove the top from my lubricant and insert lube, starting with that, and letting the first 2 to 3 inches sit in the lubricant to be used later. Then I'm going to remove my collection cup and put it over here. I'm going to pour my iodine solution into this reservoir, and I'm going to clean the perineal area with one swoop down the right side, one swoop down the left side, and one down the middle. And now I will take my urinary catheter tubing, with the syringe still attached, and I will insert it into the urinary meatus. Spreading the libia, I will let the patient know that any discomfort, slight discomfort, is normal, and I will begin inserting the tubing. I'll insert 3 to 4 inches And then I will inflate my balloon. I'll remove my syringe, and I will slowly and slightly pull back until I meet resistance. And I will go ahead and tape the tubing to the inner thigh. According to our book, the male is to be taped to the abdomen, but Dr. Andrews, as you had mentioned in lab earlier, to just go ahead and tape everything to the inner thigh. Next, I will take the tubing, being careful not to lift it above the bladder, and I will come and hang it on the side, on the bed rail right here. And I will take my tubing and make sure to remove any of the excess iodine. I will discard that. And then I will clean up my sterile field. And dispose of it properly. And if I were to do a collection right now, since I've just now inserted the catheter, I could take the urine from the collection bag for the first 5 minutes. After that, I would have to take it from the urinary port. So now I'm going to recover my patient. Asking them if they have any major discomfort or feel any pain. None is felt. So I will remove my gloves. Hello. My name is Sarah. I will be your nurse today. Can I get you to tell me your name and date of birth? All right, thank you. All right, it looks like according to your doctor's orders, we are going to be removing your urinary catheter that we inserted in you a little while earlier. So I'm going to put on my gloves. I'm going to uncover my patient. And now I would empty the collection bag into the proper input-output specimen area, or discard it appropriately as needed. And then I will bring the tubing up, careful to not lift it above the height of the bladder, and remove the tape from the inner thigh. Letting the patient know they might feel some discomfort, I'm going to remove the tube now. After I have removed the water from the balloon, I will insert my syringe back into the port, and I will slowly pull out the water. Being careful to remove all 10 milliliters. Then I will remove the syringe and discard of it appropriately. And letting the patient know they might feel some discomfort. To take a deep breath as I remove the tubing and discard of it appropriately. Ask the patient if they feel any discomfort, major discomfort or pain. I'll recover my patient. Lower the bed. Asking them if there's anything else I can do to help them. Nothing is needed, so I will remove my gloves, and I will go and document my procedure.